Ooh, what's up, nerds? Back with another video. In this video, we're going to be going over American Aquatics and Safety Training, Class for Life, CPR guides, and additionally, we are going to be going over the various written test information because I have a lifeguard certification class coming up. I also enjoy having various YouTube videos to put me to sleep, and sometimes I can't sleep and I just kind of enter this little meditate zone where I kind of just listen to stuff and fall asleep into the, or not fall asleep, but like fall into the book, fall into the podcast, whatever it is, end up just listening all night long, apparently. And so I have the CPR official course. I've got the written test information, and I'm going to essentially be going over that so that when I go to bed, I can possibly study in my sleep or just listen to things I know. And so let's get right into it. All right, so here is the printout. I'm just going to be reading off of it. The paper didn't scan so great, so it's just pictures, but you can still see it, so whatever. So this is the first table, is what you do if there is no pulse, no reaction from either the baby, child, or adult. And so we're going to go over all three. So first, when you're performing CPR in an adult, you should be pushing down from between 2 and 2.4 inches when you are performing the CPR chest compressions. The compressions should be between 100 and 120 presses per minute. And again, the classic is staying alive, staying alive, staying alive, staying alive. Or if you want to be kind of depressing, funny, or dark humor, you could go, another one bites the dust, another one bites the dust. And there's some more future, more modern songs that people have done, but I just like those two. If there is one person performing CPR, you go at a rate of 30 compressions to then 2 breaths. If there are 2 people, you do 30 compressions to 2 breaths. You do use an AED, like all of these use an AED. And if the person has a pulse but is not breathing, you are giving 1 rescue breath every 5 to 6 seconds. You do not need to perform chest compressions because they already have a pulse, which means their heart is beating. For a child, the depth of compressions is 2 inches. Similarly to adults, you are 100 to 120 compressions per minute. Same thing as an adult. If it's one person, it's 30 compressions to 2 breaths. If there's 2 people, here's a difference. It is 15 compressions and then 2 breaths. You do, in fact, use an AED, and if you have pulse but not breathing, the rescue breaths are 1 rescue breath every 3 seconds. So you are giving a rescue breath quicker than you would if it was an adult. And for an infant, you are compressing or giving compressions at a depth of 1.5 inches. And then the rest is very similar to children. You are doing 100 compressions to 120 compressions per minute. You are compressing at a rate of 30 compressions for every 2 breaths. When there are 2 people, you are pressing 15 times to then 2 breaths. And we will come back to something for infants that we talk about later in the written test. There is a thumb technique where you are holding the child, which again, we'll go over, but that is, if there are 2 people, that is the technique that is used, and that's just what it is. For an AED, you do use it, except the pad placement is different than an adult or a child, depending on how large. And if the person has, or the infant has a pulse but is not breathing, it is just like a child at 1 rescue breath every 3 seconds. Now, The steps before starting CPR include checking the scene to make sure it is safe. And if you are watching the YouTube video right now, that means you are motioning with your hands that the scene is safe. You say, check the scene to make sure it's safe. You say, the scene is safe as you move your arms as such. And then you put on your gloves, which are non-latex gloves. And then you say, self is safe. So you go, scene is safe, moving your arms around. Then you go, self is safe, put on your gloves. Then you check for responsiveness, which means you tap on the shoulders of the adult and you say, are you there? Can you hear me? Hello, anything like that. Sometimes you do again, this is if you're watching the YouTube video, you do a cross on either side of their shoulders. That way, if they stand up after you check for a response, they're not smashing into you. You have protected yourself a bit with a cross with your hands. And for a child, you are tickling their toes, because babies, obviously, they're not going to say, yes, Luke, yes, I am awake. Hello, thank you very much for checking. They'll just giggle or they'll make some sound. So you go, hello, baby, 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 tickle the toes. If there is no responsiveness, then you have someone call 911. You say, you call 911. And if there's another person, you say, you call 911, you get the AED. If there's only one person, then they must do both, obviously. Then you look, listen, and feel for 10 seconds, which for an adult, you are putting 2 fingers on their neck to check their artery, right? Sorry, actually, right now, I can't remember the artery. It's later in the videos, we'll have it. But you have your finger on their neck to check their artery. You want to make sure that you are not putting your arm over their body, because that means you can accidentally press on them. You are checking closest to you so that your arm does not go over their body and crush them. Then you are tilting their head, or making a neutral position for their head, resetting their head, not tilting their head, but resetting their head. You have your arm on their neck. You're listening with an ear to their face, to their mouth, and you are looking down the body at their chest to see if there's a pulse, to listen for any breathing, and to see if their chest goes up and down. For the baby, you are not using your thumb. You're using 2 fingers on their bicep, because your thumb has a heartbeat in it. So you are using 2 fingers on their bicep to feel for the pulse. Similarly, as the adult, you do not check the arm on the other side, because you could risk, squishing the baby, which is not good. And then again, got your arm on the bicep, head down, and looking for a pulse on the baby. If it has no pulse, then you start CPR as listed above. And if they have a pulse but is not breathing, rescue breathing as we have listed above. Legally, the reason you can do CPR on an unconscious person is because of implied consent. Again, if someone is dying, you have to assume that they want to be alive, unless they have a tattoo or some notification, a wristband or something that says, don't revive me if I die. But if they do not have anything like that, then it is implied consent that they do, in fact, want to live, and you can do that. If you help someone while you are not getting paid, you will be protected by the Good Samaritan law, because, again, you are just doing your best to save a life, and you can't be thrown in jail if you do everything properly. Now, if you mess up or do things improperly, then you are still liable. However, if you are doing everything properly, even if you're not getting paid on duty, if you're just out in the public, you can still, you are protected by the Good Samaritan law. And if you are getting paid, you are on duty, then you have a duty to act. This is why you're getting paid. This is why you are a lifeguard. You have the ability to save their lives. It is your duty to save their lives. For an AED, an automated external defibrillator, first you need to dry them off if they are wet. Electricity and water does not go together if you don't know that by now, then try throwing a toaster in the bathtub while you're in it. I'm just kidding. Do not do that. That is a method of suicide. Do not do that. If they have hair on their chest, shave it or remove it with the AED pads. If they have piercings, place the AED pads on the side of it. Similarly, metal and electricity do not go well together. Just ask Benjamin Franklin. If they have a medication patch, remove it with gloved hands. And if they have a pacemaker, put it on the side of it. Pacemakers can be tricky. However, AEDs do have the ability to identify a pacemaker. So just let it, well, skipping ahead a little bit, but one of the reasons why you don't need to perform CPR anymore is because there's an AED present and the patches are applied to someone, and the AED will identify what is the problem and tell you what to do directly. A BVM, a bag valve mask. It requires 2 people to operate it. One person holds the mask. When you are holding a mask, you are doing 2 C's so that you can, if you're watching the YouTube video, you do 2 C's so that you can press down on the top and bottom of the mask to make a seal, and then the other person squeezes the bag to provide air or oxygen. Oxygen is more better. Air has different things in it. Oxygen is what you need. So the broad end of the mask goes between the lips and the chin. If you use an adult mask on an infant, reverse the mask, making it upside down. So the broad end of the mask means the, thick, wide end. It's shaped almost like a triangle or a pear. Obviously, you put the thin part on top of the nose and the thicker part goes over the mouth. It's the only way for it to fit on an adult. It should make sense, but just to point it out. And if it's an infant, you put it upside down, and both times you are, again, using the 2 C's of the hands to press it and keep it down on the person's face to make sure it's a nice seal. So reminders: no pulse means starting CPR. Pulse but not breathing is rescue breaths. When doing CPR, push hard and fast. Allow the chest to fully recoil between each compression. And FYI, when you do CPR, you might break his or her ribs, and that is okay. Again, the implied consent part is that someone would rather have broken ribs that heal easily than to be dead. Okay? Next page. Times when you stop CPR. So there are 7 times when you stop CPR. 1, they have a pulse. 2, EMS arrives and takes over. 3, victim begins to vomit, in which case you roll the victim into the recovery position. 4, AED arrives and analyzes the victim. 5, someone hands you a do not resuscitate form, a DNR. 6, the scene becomes unsafe. Or 7, you are too exhausted to continue. And 7, you are too exhausted to continue. That doesn't mean that you're sweating a lot and you're just like, man, this is really tiring. I wish I could stop. It means you are too exhausted as you are going to create another patient or increase the amount of people that require medical attention on the scene. It's not like, oh, my arms hurt. Who cares if your arms hurt? You are saving a life. It is your duty to act. Just because you're tired doesn't mean you stop. It means too exhausted, like you are going to create another health issue on scene that requires, attention. As long as you can continue to go, doesn't matter if your arms hurt, you keep going. You have a duty to act if you are being paid. And again, if you fail to do this because, you just decide that you're tired and you want to stop, you've been doing it for 5 minutes, nothing's happening. As our instructor says to us, he was performing CPR for 45 minutes in one case. Now, head positions for the victims. For adults, you tilt the head slightly back. For the child, it is slightly tilted, and for an infant is in a neutral position. Now, for ventilations, which again are different than rescue breaths. Ventilations are what are performed during CPR and are to provide oxygen. So, for ventilations, if you give a breath and the victim's chest does not rise, retilt the victim's head. If the second breath does not go in, begin CPR. 2. If you remove a drowning victim from the pool or lake and the victim is not breathing or has a pulse, prior to starting CPR, give 2 initial ventilations. 3, when doing CPR and giving ventilations, you wait 1 second between each breath. And what they don't have, which is a good number 4, is that you are not blowing a huge breath into a baby. You are not giving a into a baby. You are giving a into a baby. They have much smaller lungs. They don't need a huge, crazy breath from you. Now, checking for responsiveness. Adult and child tap on the chest and shoulders, or chest or shoulders, and ask, "Are you okay?" Infant, tickle or tap on the baby's toe. You are looking for movement of the toes, and that should be tap. Tickle or tap on the baby's toe. Now, look, listen, and feel. Adult and child, you are checking for a pulse on the carotid artery, which is again the neck, looking for the rise and fall. You are putting your ears above the mouth and listening for breathing. For an infant, you are checking for a pulse at the brachial artery, looking for the chest to rise and fall, putting the ears above the mouth to listen for breathing. For choking, for either sex, and they'll have something for pregnant on the next page. So for choking, you need to get consent before beginning. For an adult or child, you do 5 back blows followed by 5 abdominal thrusts and repeat. For an infant, it's 5 back blows followed by 5 chest thrusts. If the victim is pregnant or obese and the rescuer is not able to reach their hands around the victim, the rescuer will use a modified version of the rescue. If the victim is unconscious or becomes unresponsive while administering back blows and abdominal thrusts or chest thrusts, lay the victim down and begin CPR. And again, if you're watching the YouTube video, the universal sign for choking is the 2 hands going at the neck, or a version of maybe 1 hand at the neck, 2 hands at the neck, but it's something, if they've got 2 fingers pointing at their neck. And what they also don't have on here, which I'm sure they'll go over in the picture, but it is a closed fist with a hand around it, and that is the positioning of the hands for the for the maneuver. We'll scroll down a little bit. You can see, so we've got the 5 and 5 back blows, 5 abdominal thrusts, but you can see his hand. 1 hand is gripped into a fist, and the other hand is palm facing the fist, and that is the combination. But so before we get to that, so these are the various photo positions. If you're watching the YouTube video, they're just showing off the various techniques we've just talked about, however, with photos. So for an adult and child, your shoulders are above the wrist, elbows are locked. You interlock your fingers and place the palm on the hand, or palm of the hand, on the center of the breastbone, slightly under the nipple line. And to show you on YouTube, you've got your hands or your fingers out. You interlock your fingers and you place your palm on the person. You have your elbows extended. And again, you should have your shoulders be above the victim in the direction you're going to pump on a straight line. That way you're not losing any energy. You're able to keep a steady rate, because again, you want to be doing 1, 2, 3, 1, 2, 3, or, like we said before, staying alive, staying alive, staying alive, staying alive. And so you're going to be with your whole body. That way you're not pushing out with your arms, which would be easier to have to not have the correct timing. So for one person on an infant, you have your shoulders above the wrist, elbows are locked, and you place 2 fingers on the center of the breastbone, slightly under the nipple line. Again, what are we pressing on an infant? Think to yourself. The correct answer should be 1.5 inches. Correct, 1.5 inches. We just scrolled back. So second hand should be on the head, holding the infant in what position? A neutral position. Correct. And so the two options, you can either have the two fingers, as he has in the photo, which are pointed outward and pressing in a vertical line, or if you have extra joints in your finger, or you're a double locked or a double jointed finger, or if you have finger injuries, it is also acceptable to have the fingers at a horizontal angle, just because some people have different fingers and it's actually harder for them to push in a vertical line. So for a two-person on an infant, the first rescuer should place both of their thumbs on the center of the breastbone, slightly under the nipple line, while having the rest of their fingers under the back. The second rescuer should kneel behind the head and give breaths. And this is the encircling thumbs position. And that is because you are encircling the baby with your hand, and you have your thumbs on their chest, and you are pressing like that. And the other person is giving the ventilation breaths, and they are doing so with the two C's, the hands on the two C's, to make sure that there is a tight seal with the either the bag and valve mask or the mask if they're breathing into it. So for AED pad placement, the adult and child position, you're on the top right of the victim's chest and under the left armpit. So for you, that is going to be the top left of the victim's chest and under the right armpit when you're looking down on top of them. And for the infant, they're going to be on the chest and back. So again, we've talked about choking a little bit. With the adult, is 5 back blows and then 5 abdominal thrusts. For a child, it's 5 back blows and the abdominal thrusts. However, for the infant, you can see with the picture, and I'll try to describe, for the infant, it's 5 back blows, and then instead of, because you're not obviously going to squeeze the infant into your chest, you lay them over, you have their head cradled with your hand, and you are pushing into the chest almost like CPR, however, at a much steeper angle, with the baby's head backwards, so that they hopefully expel whatever is in their throat. And if you cannot get your hands around them or they are pregnant, you are essentially above the pregnant belly, lower than the breasts, and in between that area is where you are giving the abdominal thrusts for a pregnant woman or someone who is a larger person. So those are the 3 pages from the American Aquatics and Safety Training Class for Life. And so now in addition to that information on the test or on the during the lesson, they also give you a bunch of notes about various different things that could happen, various CPR things, various emergency things. And so what I did is I essentially took all of that information, I wrote it down, took notes, and then I put it into ChatGPT and was like, hey, Chat, take this stuff, analyze it, find out where I'm wrong, add any sort of American Red Cross information that I was missing, take all that, print it out, and put it into a study guide. So this is the Lifeguard, CPR, AED, and Emergency Response Study Guide. So we're going to go through this right now. So section 1, the 4 basic steps of an emergency. First is size up the scene, which includes ensuring the scene's safety, identifying any hazards. You're using personal protective equipment, PPE, gloves, a mask with a one-way valve. You should determine the number of victims and the mechanism of the injury. You have your initial impression, which is where you identify life-threatening conditions, LOC, which is levels of consciousness, breathing, severe bleeding, cardiac arrests as some things that could be, situations. Your primary and secondary assessment. So your primary assessment is to check responsiveness, open airways. So it's exactly what we were talking about during CPR. However, for your secondary assessment, that is when the person is conscious and you follow sample. You have signs and symptoms, allergies, medication, past history, last oral intake, and events. For an adult, you do head-to-toe check, and from child, you do toe-to-head. After that, you begin to provide care, and you activate the emergency medical system or emergency. They have another term for it, but it's essentially you should have at your job or wherever it is, you have some sort of action plan for if an emergency was to happen. So first you activate that plan and then you treat the person appropriately. Section 2, common medical injuries. So first we have a heart attack, which can be identified by chest pain, trouble breathing, sweating, nausea. That is the response as you call 911 and prepare for CPR. If they are having a stroke, you should remember the FAST algorithm, which is you look for a face droop, arm weakness, speech difficulty, and then the time to call 911 or time for them, do you know what time it is? And then, and then also time to call 911 because strokes can happen quickly and the window for you to, the window for you to treat a stroke is very small. So time to call 911 is important. Seizures. If they are in the water, you support the head and let the seizure play out. Then you remove them from water. Then you call EMS if if the seizure lasts longer than 5 minutes or if it's a first time. For diabetic emergencies, you've got hyperglycemia and hypoglycemia. So hyperglycemia can be identified by warm, dry skin. Hypoglycemia is pale, sweaty, a sudden onset, and you treat, so hypo, I remember is low glycemia or low glucose, and you treat that with some glucose tablets. Hyperglycemia, if anything, you give them natural fruits, but no sugar or anything like that. Wounds, or no like processed sugar. So for wounds, there can be internal bleeding or external bleeding. For internal bleeding, there's bruising, shock signs because it's something that did enough damage to break things inside their body. However, there's no external symptoms, so your body goes into shock a little bit. For example, if you hit someone in the head, or if someone gets hit in the head, they might get raccoon eyes from the blood inside of their skull. For external wounds, you've got abrasions, lacerations, incisions, punctures, avulsions, and those are treated by applying pressure and dressing the wound. Well, cleaning and then dressing the wound. So for burns, you've got first degree, second degree, and third degree burns. First, you want to stop the burning, get it away, obviously, from whatever was causing it. Then you cool, let the wound cool, and then dress loosely. There's also chemical burns, which is where you should brush the powder or flush whatever liquid fell on the wound for 15 minutes. And if it's severe for any of these, call 911. If there's a poisoning, you just call poison control, tell them what happened, so they'll let you know what steps to take. There's heat illnesses, heat stroke, heat cramps, heat exhaustion. So you want to move to a cool area, hydrate, and call EMS if it's a severe heat stroke, because again, strokes, the window to treat them is small. For hypothermia, you can identify that by shivering, numbness, confusion, and you want to warm gradually from the inside out. From the inside out, you warm gradually. You don't want them to be tossed into a hot tub and because you think that, oh, well, they're super cold, so throwing them in a hot tub will help. No, you just let them warm inside a blanket, multiple blankets maybe, but you let their body warm them from the inside out. For shock, you want to lay flat, keep warm, and call EMS. For musculoskeletal injuries, you've got RICE, rest, immobilize, cool, and elevate. For asthma, you hope that they have their inhaler with them. If not, there's not much you could do other than call EMS and wait. Traditionally in the past, they had box breathing with paper bags, but not everybody has around paper bags anymore. For allergic versus reaction, or allergic reaction, there's mild versus anaphylaxis. So for mild allergic reactions, usually can be handled without emergency rushing. However, for anaphylaxis reactions, that's where they can go into anaphylactic shock, which is their throats can seize up. It's significantly more dangerous. And most people in those situations have EpiPens on them. And while you cannot administer an EpiPen as a person directly, you can help them with theirs. If they say, they've got an EpiPen, but they can't close their hand, you can put the EpiPen in their hand, close your hand around them, stab them in the thigh, and inject them because they would die. But you cannot apply it yourself, but you can help. For Narcan, it's for opioid overdose. So the instructions come on the Narcan package. Fingers crossed, you as a lifeguard are not dealing with anybody who's having an opioid overdose. But all the instructions are on the Narcan package. For anxiety and hyperventilation, the best thing you could do is just calm the victim, try some breathing exercise. Breathe in, 1, 2, 3, hold the breath at the top, breathe out, 3, 4, 5, or 3, 2, 1, whichever. But essentially, breathing exercise, nice simple one. Deep breath, right? Hold deep breath, breathing in 1, 2, 3 seconds, hold at the top, 4 seconds, maybe 5 seconds, breathe out, 3, 2, 1. For documentation, when you're reporting any incidents that happen, you want to include the facts only, the location, date, time, your name, victim's name, actions taken. You don't want to presume anything. Oh, I think this could have happened because of this. I think this. I think that. There's no I thinks. Just only the facts. Keep them concise. Don't speak any more than you have to, because God forbid anything happens that's wrong. You will be held liable. This is America. People love to sue. Consent. Ask twice. This is important for the test. For consent, you ask twice. For adults, unconscious is implied consent. Children require parent guardian permission, and again, ask twice. Especially on the test, you come up, you're doing the test, you have to practice your CPR during the test, and they say, oh my God, my baby's having whatever. I'm a certified lifeguard. Can I help your baby? Can I, see if there's anything I can do? No. Make sure to ask again. Are you sure you don't want me to help your baby? Just to note, again, very similar to the first first page, a little repeats in here. Lifeguards, you have a duty to act when you are on duty, and when you are not on duty, you are covered by... I brain farted. You are covered by Good Samaritan. I was going to say like angel, but it wasn't angel. So Good Samaritan when you are not on duty. So again, this is just some repeats, but just to, really dial it in. Section 3, CPR and AED procedures. For adult CPR, first you check the scene. Again, during the test, you make the motion above. The scene is safe. Then you put on your personal protective gear, non-latex gloves, your PPE. Scene is safe. Self is safe. Check responsiveness. If there's no responsiveness, then you call 911, you get an AED. Then you believe your look and feel, which is you check breathing and pulse. Again, for the adults, you check on the neck. For the babies, you check on the biceps. Not with your thumb, and you're making sure you're not reaching over. You're checking on the same side that your body is so you don't accidentally squish anybody. If there's no breathing or pulse, 30 compressions, 2 breaths, 2 to 2.4 inches on adults at a rate of 100 to 120 per minute. If they are pulled from the water, you get 2 breaths first. Infant CPR, again, brachial pulse check on the bicep. Encircling thumbs method is if there are 2 people. And for depth, it's 1.5 inches, or about 1/3 of the chest. Again, stopping CPR. You stop CPR for 7 reasons. Too exhausted, EMS arrives, trained responder takes over, unsafe scene, if there's sign of life, AED is available, or a valid do not revive. And for AED use, again, turn on AED, dry chest, apply pads, stand clear, follow prompts. And that is the end of the study guide. So that's it. I just kind of made this video for myself so I could have something to listen to, something that would have good study stuff for the lifeguard course. If this helps other people, it helps other people. Obviously, this is just my course. It's 2025. Who knows if things are going to change in the future? I'm not saying I am not an accredited teacher or anything. This is not, you should follow your own study guides as well. But this just is everything I had. And it's just, a nice little coverage. And I hope it finds you or is useful for you or other people. And if it's something that you enjoyed listening to go to bed, then enjoy the rest of your night. Sleep tight, baby boy.